Good afternoon and welcome to the Spirit of the Valley. I have a wonderful, wonderful returning guest today that I enjoyed last time, and so did many of you because we heard about it. Dan Villiers is now I'm going to get it wrong even though he just told me, the founder and director of admissions at the Mountain View Treatment Center.
Mountain Valley.
Mountain Valley, see how easily I do that? And it's just north of us, and Dan has been the whole instrumental end of getting this thing off the ground, and it has to do with anxiety mainly, and we talked about it last time in terms of how many people watching right now, or how many friends of people that are watching right now would love to hear this because they have children in the same boat as what you're going to talk about, and it's an epidemic. Mm-hmm. Dan, welcome back.
Thank you so much.
I am so glad you're back. You've got so much news since the last time we met.
I have.
Yeah.
And I've been very, very much looking forward to sharing.
I'd love to hear about it because just the beginning was what we talked about, and now you're beyond that by miles.
I know. Yeah, we've come a long way in the last year.
Yeah.
We started out as a 12-bed program. It was far from being full. We went from having 4 kids in the program to 8 to 6, and then we sort of averaged 11 and 12, and then we really expanded the facility to make it a 20-bed program, which was, I think, the ultimate goal at some point. To really build that sense of community,
right.
You need that sort of. It helps to have that many kids, and especially when it's co-ed,
right.
To have an even distribution of boys and girls is.
And how even has it turned out to be?
Extremely even, actually.
Good.
A lot of the statistics of research has shown that more women have anxiety than men, and especially girls than boys. But it's a bit a skewed research, mainly because boys are less likely to come forward and sort of admit it or seek help.
Still the macho thing?
Yeah.
Is that what you...
Very much a bit of that. So, but what I've seen and the new research out is that it's a pretty even split.
It wouldn't surprise me, given what the numbers are like now. It's got to be somewhat even, because I know it's an equal opportunity disorder.
That's right.
Think about it, or equal gender. So tell me, you're up at how many now, 18?
We're a 20-bed program, and we have anywhere from 16 to 20 students at a time. It's there is some turnover because it's a short-term program.
Sure.
So kids are we usually have a graduation, once a week or sometimes.
Once what people don't get is that this is meant to help them and send them back. I mean, they're ready to go back to what they weren't able to do when they came to you.
Absolutely.
And that's what's fun about it. It's not a long-term commitment.
Yeah,
hopefully.
Short-term, 30 to 90-day program.
That's
very intensive, and the goal is to get them from that sort of housebound state, which a lot of these kids are, to school-bound, back to school.
So these are kids, as we went, just to reiterate what we talked about before, they really are totally anxious about being in school, period. And there are a lot of reasons behind it. A lot of things drive anxiety, but they really are scared to be in school.
Yeah, and it could be the fear of school itself, or maybe some of the kids at school. Often the school refusal or avoidance is a symptom of the anxiety disorder.
Right.
So whether it's social anxiety or obsessive compulsive disorder, panic disorder, those situations kind of force the child to resort to basically staying at home. The world has become a place, and school especially, a place of threat. Mm-hmm. Unfortunately, the most effective short-term strategy to avoid threat and anxiety and panic is avoidance.
Exactly.
But that obviously can grow into something you become dependent on.
Well, but it can become a lifelong place to be if no one is helping. I don't want to say intervening, but in a way it is, because you're really looking for these kids. And I know you travel around, you sit in their living rooms for days and weeks at a time, maybe return visits, before you have the relationship and rapport that this kiddo made you say, I think I'll try that. He sounds like he knows what he's talking about.
It's been my favorite part of the experience has been to meet the kids in the home and meet the families in their home. There's nothing like, not only it's an opportunity to see the family dynamics, to learn about the child, to do my own assessment, but the parents are just as anxious as the children, and I am that. I want to be, and I have been, I think, that agent of change for the whole family, to say, I'm going to trust Mountain Valley with my child, and believe that the work that they do is really going to help
convincing them as much as anyone, because they are the ones that are letting go of their child.
And it's become easy, actually, over time. Now we've got some, wonderful data to show our success rates. Close to 3/4 of our kids return to either the school that they came from or go on to another school. And, they may still struggle with some anxiety, but not to the point where it controls them or makes decisions for them.
And being afraid of being in school has either diminished or disappeared.
Yeah, they have that sort of renewed strength, renewed sense of self and identity, and that they've overcome something tremendous, which is what we call a mountain of fear. They have climbed the mountain, so to speak.
And they're in a safe place versus what they used to call a very scary, dangerous place.
Mm-hmm. That's right.
Wow. So you also you've talked with me about new programs, new collaborations, new rather pleasant place on Buzzards Bay. I'd like you to do some more of that, because this has grown, folks, from that one building where things were bubbling but not bubbling over. Now it's suddenly
it has.
Huge.
I think there are a number of inspirations behind the creation of Mountain Valley, and it has become very successful, and we determine success by the impact that we have on these kids and families. That's what we're driven by. But through that, we really, I think, are pioneers in bringing mental health treatment to an area of specialization, and really using the power of the shared experience that our kids have, in that agent of change and in that process of recovery. And so specialization not only in the clinician's ability to and experience to treat specific disorders, but in also having each of the residents at Mountain Valley, let's say, use those shared experience to motivate each other.
Exactly.
And I think that's been a real two of the biggest determinants of our success.
Well, it's a little bit like a kids support group in some sense, because they know they're not the only people there that have lived what they've been living through.
Yeah.
And that's somewhat helpful to anyone who suddenly says, I'm not alone.
Absolutely. Yeah, we call it it's the normalization process.
Yeah.
We are a community of empathizers, and that's a wonderful place to be. So, one of my missions has been to really promote specialization within the mental health field in a similar way that the medical world has done, in the sense that, there are neurologists, pediatric neurologists, and yes, mental health is a bit more complex, and there are co-occurring disorders, but it doesn't mean that you can't specialize in a certain disorder or spectrums of disorders. And so, because in part I think of the success of Mountain Valley, Jay Walter, president of the Beckett Family of Services, wanted to sort of take this further and say, okay, what else is out there? What are some of the other unmet social needs? And I think one is co-occurring issues, primarily internalizing disorders and substance use among teenagers.
Yes.
And I help certainly inspire the creation of this program and specialization of it, based on what I had been seeing out on the road in the homes. I'd be there to see this anxious, fearful, phobic kid in the basement or in their room with the door closed. But there'd often be either a sibling that might be smoking marijuana every day, or might be misusing their ADHD medication, their stimulant medication. I was hearing stories like that, and the parents would say, I want my other daughter or son to get help. Where can they go? And as you know, there are a number of alcohol and substance abuse places around the country, but they're often sort of more intense. They're detox places, designed for the place where really people have reached a rock bottom and need, a true
total immersion kind of situation.
And those programs are fantastic and needed, but I really noticed a void in the field of kids that were misusing maybe prescription medication. They were smoking cannabis. They were using alcohol, but it was usually a self-medication strategy for their anxiety or depression. Often their executive functioning challenges as well.
Exactly.
But I struggle with those kids necessarily being in a very intensive detox or drug and alcohol treatment center. So. And also, I really wanted to see if we could create a place that could not only intervene when those behaviors are happening, but also prevent it from going down that road.
Right.
So preventing that a potential rock bottom that could happen you know, X number
Well,
of years later.
it's all about prevention in my mind, and whether it's general medicine or mental health. I mean, nipping anything early is the secret, and you've got that extra advantage of being in a house where maybe there is that extra problem going on that that you weren't there to see, but you found it.
And it's not, and sometimes being a sibling in the home, or it's someone they know, someone in the community or in the school.
Right.
And you know, if it was once or twice I heard it, but it was so many times that I did sort of research on what else is out there, and there are programs that deal with more sort of soft levels of substance use. Yeah. But what we really wanted to focus is on an internalizing disordered child, and really what that means is kids that primarily struggle with anxiety, depression. Sometimes there's some learning disabilities with that, and really it's called internalizing because it manifests itself not in a disruptive way.
Right.
You know, they sort of look inward.
It's kind of a silent, almost invisible situation going on.
That's absolutely right. It's and they withdraw and turn inward, and withdraw from school and society.
And clearly, one of the problems with that is they don't know how to verbalize it. They don't know how to bring it up, or what's wrong? Nothing. Are you okay? Sure. I mean, that kind of thing must go on all the time because they don't have the tools or the whatever to open that conversation. That's a tough one.
That is something I've been talking a lot with my colleagues about recently. They often ask me, you know, why can't some of our kids or the kids that we've worked with regulate their emotions? And it's really hard for teenagers who don't know how to express emotion, interpret emotion, show emotion. When they can learn those skills and practice those skills, that's when they can regulate emotion.
I think, and I was going to take a quick break here for us, and then I'll get Luke to reset our clock because he has a wonderful little gizmo here. Assume you're leading up to is one of the most exciting things happening right now, and that involves, well, you tell them.
It's the creation of the Panikies program, and as I was saying, you know, there were several things that inspired the development of this place that has been created by me and other colleagues at Beckett. Is not only what I was seeing on the road, but the abundance of research that is showing that 50% of adolescents with anxiety have a substance use issue. But interesting, within that group, it's majoritively cannabis use. 62% is cannabis use. Around 23% is stimulant medication use, like I mentioned, and then a small group is more severe drugs. Like sort of opiates and hallucinogens. So you know, it's our goal to and we have created a place for
talk
these
about
kids.
It because it's an extremely interesting.
It is unique. I went there recently. You know, I consulted and collaborated on the creation of the program description. But it's a beautiful island off Cape Cod, in between. Well, I guess it's near Martha's Vineyard.
It's on the Buzzards Bay.
Yeah.
I happen to know this. This is dear to my heart, having heard this, because I could see this place from the home some family had. Peniquise, which is in the Elizabeth Islands, and it's somewhere between Cuttyhunk and Nantucket. And I literally could see it out of our living room window. And so when my husband, who used to be connected with your outfit, told me about Peniquise, first of all, he was saying Pekingese, and I had to get him out of that. But I suddenly went, oh my gosh, we used to sail over there. So it's a very exciting nautical, right in the middle of the ocean. And
it's a fascinating island. It's, I believe it's about 70 acres, but I may be wrong. But it's a small island that is a bird sanctuary right now, and it's basically not open to the public. It's owned by the government, but they have allowed us to have a program there. Now, there was a program for many years there. For adjudicated youth and kids struggling with aggression. And Jay Walter and Beckett really sort of saw this need that I described.
The vision that man has, along with other folks like yourself, the vision of what can happen where is wonderful.
Yeah, it's not only his vision, I think it's also his willingness to explore and accept other people's visions.
He does it, and I think that you wouldn't be where you are, nor would the Beckett umbrella be as big as it is.
I know. So it's a beautiful island. There is a cove. I arrived on a boat the other day. It was a beautiful, gorgeous day. I remember wanting to dive into the water right away. I couldn't believe that this was going to be the site of a residential treatment program. But it provided a sense of peace, just the land, the water. You're isolated, but you don't feel isolated. I mean, you really, I think it's going to be the perfect place to build a community of kids with the similar issues.
It will. It's not impossible to get to. It may seem it just because we know it's out in the middle of the bay, but we used to get there very easily. But it's exciting to think of a place with a campus like that. You don't often see it. And this is going to provide, as you say, peace, but it's also going to be exciting.
Yeah.
It's a whole new, no one's ever going to go to school or any other kind of institution in a setting like that. So and they're kind of a captive audience, I must say.
Yeah.
They aren't going to run away.
They could swim maybe, but good luck. But no, I think two things that make a program, and many things make a program great, but two things is, you've got to have great treatment. Yeah. And the kids, you've got to find ways for the kids to have fun.
You bet.
A hospital setting can provide great treatment, but do they always have fun? And they've got an array of activities planned for these kids to build that sense of community, to grow that self-esteem, that self-concept. So sort of integral in the treatment and recovery process.
Phenomenal.
And we've built a fantastic clinical team, administrative team. We'll be opening August 15th.
It's very close.
And I cannot tell you the interest that we've had already.
This is what's striking. I mean, you think of it as something that's so extraordinary, and I appreciate it, you appreciate it, but someone who hears where it is might think, a little remote. It's not. And obviously they're seeing what's behind it that make them, even if that was a hesitation. Well,
it's a drive down to Woods Hole, and that's the sort of port when you go to the Vineyard and the other islands. And, it was a 45-minute boat ride, and it was a beautiful ride. And,
it is a great ride.
Yeah. I think it's almost a dream location to have a treatment center.
Well, the boats that go by, I can remember growing up there, you'll see everything from the America's Cup boats to all kinds of regattas. I mean, it's a very busy little strip.
It is.
Up to Newport one way, and it's just it's a lovely location. I'm not at all biased. I grew up there.
That's good. So it's really a setting that I think is going to be inspirational, but what's truly great about it is this new, I think, or increasingly emphasized vision and mission of the Beckett Family of Services to be specialized, to really adopt what I see as a social entrepreneurship vision and mission that is always seeking to, how can we do things better? How can we, meet the needs of society? And how that must always be at the forefront of what we do.
Has to be.
And it also helped, influence our creation of what we've termed the Family Support Collaborative, which is an organization of 4 programs. Mountain Valley is a member of the FSC, as we call it. Pennicky's program is a member now. McLean Hospital is a member, and the Ocean School Foundation is another program. And there are several themes that these programs share. And one main theme is that they really value collaboration, obviously. Yeah. They all work with children and families. And they really see the power of sharing experiences, expertise, holding each other accountable.
Yeah, exactly.
Really making sure that a program doesn't work in isolation, that we leverage and maximize our individual strengths for the larger system.
It's collaboration, teamwork. There's so many good names for what you're going to be doing, but it all comes out with a better product.
Yep.
It has to. So that's exciting. So in just a few weeks, Pennicky's is back on the map.
Yep, Pennicky's back on the map.
Wow.
I'll be really acting as a clinical consultant.
So how often
we have a wonderful director of admissions, Patrick McAvoy. Jay Walters, the executive director.
Right.
Toby Lineweaver is the director of operations.
Nice.
And we've already hired a superb team of clinicians that really know about substance use. And that brings me to the point that I really wanted to talk today is the the importance of there's a big argument about what comes first in regards to substance use and anxiety and depression. And generally, there's a term called the tension reduction hypothesis, and it basically refers to kids are more likely to use substances as a way to self-medicate that tension or that anxiety, or use substances to find a way out of that depression or that hopelessness that they're experiencing.
Yep.
Now, one could say at the end of the day, okay, does it really matter what comes first? I sort of believe it does, because you really want to get to the heart of the issue.
It's how you treat it.
It's how you treat it. You've got to get to the core of the issue and still treat the other issue, whether it's a symptom or a cause, with the same attention and respect.
Yeah.
But there really isn't another program like Pennickie's, and we're all very excited about it.
This is something I hope all of you can even look it up. I mean, Pennickie's is an amazing place in itself. It's not a place you would initially picture any kind of a institution or program, other than what it had been in the past, but it's got a tremendous history. It's also, I can't think of a more fun place to be. I mean, yes, you're a little bit away from other things, but it's still short term.
Yeah,
it's not,
it's short term. It's a 90 to 100-day, 120-day program.
Yep.
There's only 9 students there, so it's a really small, tight-knit community.
Will that be the cap?
Yeah,
okay.
And that's purposely. There may be some small growth, but they're limited to growth because of sort of governmental restrictions. But that's a great community. It's all boys. I should mention.
Okay.
But it really follows Beckett and the Family Student Collaborative's mission of pursuing specialization, pursuing collaboration, and how can we, as different programs, use our shared resources, our shared interests, our shared passions, as all nonprofit organizations, to really do the best work we can do for children and families.
I just love the whole mission. By the way, now that you mentioned Pennickie's, I think you should give someone some contact information.
Yeah.
Just tell all our
I can absolutely do
wonderful
that.
People.
The Director of Missions is Patrick McAvoy. He can, we'll have to give you his cell and email, because I think you can put it up on the screen.
But if you have a website or anything, they can go right to?
www.pennikies.org, and that's spelled PENIKESE.org. But that'll tell you all about the program, the staff that are working there, and update you on our opening date.
Because as I've said before, we all know many, many people who are in anxiety mode, however severe, and there's some tremendous solutions right up the road or across the bay. But either way, if this resonates with you, or you think you know someone who should take a look at this, please. And there's another thing I want Dan to do, is he's got a tremendous statement here that I told him it would be great to read, because it says everything about what he's about. And
I wasn't sure whether to read this today, but I
think you should.
The work that clinicians do, my colleagues do, it can get tough. You can't change everyone's life. You can't. Not all cases can be transformative, and there are times that you can get a little disheartened, despite however successful we've been. But I have this on my mirror at home, and I was reading it this morning driving up here, and I just thought I'd read it, because it can look like kids don't want to go to school sometimes, or they're purposely being defensive or defiant. But I really try to think that these are symptoms of something else, and that all children want something inherent, and this is what I believe.
Okay.
I believe that children want to be happy. That children want to feel liked and accepted. That children want to feel safe. That children want to make friends. That children want to actualize their skill in sport or music or academics. And that these things, and that children want to make their parents proud. To do these things, to achieve these things, and to feel these things, children need to go to school. I believe, therefore, that despite all the hurdles and hardships, resistance and refusal, and social and emotional challenges, that children in our society inherently want to go to school.
That's so neat. And as you said, there are a lot of reasons why kids, they drag their feet, they're late, they do everything they can not to get there on time, or if at all.
Right.
And there's always something going on that
Yeah.
they haven't been able to verbalize and talk to their folks about, maybe.
It's very easy to see behavior as dispositional instead of situational.
Right.
You know, it's something, you know, about them versus the context. And I think as therapists and working in this field, and I talk to my team about this, is when you're faced with a challenge in therapy, don't assume it's just the child not making that decision to work harder and push harder. You know, keep at it and realize there's a reason for it.
There's more going on than what they're being told or shown.
Yeah. Kids want to be happy. They want to feel connected.
Yeah.
And if they're not, there's a reason for it, and that's our job to get to it.
I admire you, and I think, folks, you can understand just why I wanted to see this gentleman again, because it's just taken off in the best possible ways, and unfortunately the need is only growing.
It is.
But they've got a handle on it, and I just think the contact info you have, or even just I'll put Dan's name and info up there too. But I think that's the kind of thing where anyone you think of that might benefit from this, just holler, because we all know this. And I've been through a little anxiety of my own, and it wasn't a big deal, but it was a big deal at the time. Everyone has a smattering of it, I think.
Yeah.
But just remember, there is a couple of really good choices.
Fear, anxiety, depression. They are things that, you know, almost everyone is going to go through to some extent in their life. And you know, whether it's interest about Pennikes or about Mountain Valley, or not about these, you just want to reach out. I'm doing this because this is my passion, it's my dream. So please call or email if you have any questions about anything or any. Don't
hesitate, because he means it. And
I love it.
He wants to be contacted and questioned and anything else, because this is his whole life.
It makes me very happy.
It does.
To do that.
I can't thank you enough. I'm so proud and happy for you
so
that
much,
this
Judy.
growth has happened, and it's
Yeah.
broadening, and little tentacles now out everywhere. So please, just, you know, and we may have him back when he's got 30 more centers, who knows, but for now I'm really pleased for you that this is all taken off so well.
We're going to go slowly and
that's the only way.
Make each program really, truly innovative, unique.
There's no rush.
Yeah.
Except to get to as many kids as you can, but it's not done fast. Well, thank you again.
You're welcome.
It goes too quickly, but it's the way it goes. Thank you all for watching, and I hope you got something from this. I'm sure you did, and we'll pass this along. In the meantime, I will see you next time.